Hey everyone, Dr. Charlie Johnson, physical therapist. Wanted to shoot a quick video as I just opened my email inbox and I was sent a home exercise program, you know, the sheet of the packet of exercises that a woman was given for her piriformis and sciatica problem. She said, hey, what do you think about this? You know, this is all I do, by the way. I am a specialist in helping people with back, butt, hip, and leg problems naturally using movement as medicine. So if that's something you're interested in, you want me to take a look at what you're doing and potentially be part of the plan to help you out there, then just go ahead. There is a link below in the description, www.calldrc.com. You can apply to chat with me there. So that being said, in this video, I'm going to walk step by step, let you inside my head as to this home program, which probably looks very similar to what you're doing for this type of pain or problem in the buttock going down the leg. I'm going to let you in on my thoughts and just know there's no such thing as a good motion or a bad motion. So many people reach out to me and say, Dr. Charlie, should I be doing this motion or should I be doing this exercise? And the answer is, well, it depends. So the process, I'm going to literally walk you through, not only going to analyze what she is doing, but I'm also going to let you in on the exact process I use with my clients to help discover what is best for them. So let's jump right into it here. Okay, so this is what she sent to me. So I'm literally just going to scroll through, pay attention to the date, January 11th. I blacked out all the sensitive information and you'll see that there are many things that she's doing. So let's just count them. Let's go through, give you a brief overview before we sort of analyze it. So we've got posterior pelvic tilt. It's kind of where you're, sucking your belly in, flattening your back against the floor, kind of puts you into a rounded lower back position, kind of a little bit effort through the core or the belly. Trunk rotations, hip flexor stretch, Piriformis stretch modified. All these she's doing 2 times a day, it looks like. Hip extension, so standing, kicking her leg back. It looks like probably, yep, on both sides. See what else? A little bit later, a few days later, now she's doing clamshell, so laying, kind of working the outside of her hip. She's now working her muscles slightly differently, but in a seated position. Squats, again, another sort of body weight or more resistance-based exercise 2 times a day there. Now, just a few days later, you can't really see it there, but now she's doing clams just slightly differently on her back, doing some pull downs, so some arm motions. Again, this is probably more of like an abdominal focus, just because as she's standing still, her belly has to work to hold her back and spine position stable. On her belly, working her hamstrings. Again, she's doing this on both sides. Standing calf stretch. Maybe she has some calf tightness. Side step with a band. You got to love the stick figure drawing. So I know that if you're going to PT or chiropractic or wherever, if you've gotten an exercise program from this, maybe even from the orthopedic specialist, surgeon, you've probably seen some stick figures. That's a good one. I like that. So she's doing some side stepping, holding some resistance there to work her hips. Now, remember before she was doing things standing, but now she's on her belly and she is about a month later kicking up, doing it both sides. Now she's a little hard to see, but she's putting her ankle up on her knee and she's doing it on both sides and she's pushing her leg down. In the one previous, she was pulling her leg up. And that is about it. So you can see the overview, progressively as she's introduced to these motions. I don't know, but my guess is that she was doing, say, the first page, and then a few days later, they added on the next page. They added on the next page, right? So that's kind of the overview. You've seen everything she's doing. Now let's analyze it. So here's what goes through my head when I see this. So first things first is that, look, there's no such thing, again, as a bad motion or a good motion. It just depends on sort of what you're dealing with and how you go about trying to figure out, is it worth doing this or is it not? So, I just look at all of this, and the problem with doing all of this, just to be upfront, is that you can't actually tell what's working or what's not working. So she comes to me and says, Dr. Charlie, this program is working really great. Well, I don't know if it was exercise number 3 or exercise number 5 or exercise number 12 that is working for her, right? All I know is that everything seems to be working, but as you can imagine, she's doing multiple sets, both sides, twice a day. It becomes highly inefficient. So it might be effective, but it becomes inefficient. So in the best case scenario, if this is working, we don't really know what's working for her. Fair. And I would argue that there's a more effective way to do it in the sense that we can be more efficient. And, as she goes through this program, what if instead of spending 45 minutes a day, she realized that she just needed to do one of these things. And, to me, that's a better long-term strategy, because we know that if it just takes a few minutes, you're probably going to get it done. Like, imagine if brushing your teeth took 45 minutes and you had to do it, once or twice a day. You'd never do it. So we have to be reasonable. And I always am when I work with people and say, look, we want to take a sniper approach, not a shotgun approach. All right. So this is a shotgun approach. And obviously, if this isn't working, so if there's no change and we don't really know what is kind of not allowing things to change or improve, and if things are getting worse, we don't really know an element that is keeping her from, or that is causing her to be worse. So what I find a lot of times is that, motion number one, if you want to call it that, is working, but then motion number two is counteracting that, right? So if something's not working, it's not that the whole sheet of exercises doesn't work. It's just that the whole recipe doesn't taste good together. So we want to single that out, each ingredient one at a time. So I'll walk through kind of how I do that in the beginning. But again, just to highlight some of the trouble with this. So posterior pelvic tilt, again, this kind of fits along the idea of like core or abdominal work. Right, so this is kind of a belly exercise. So we've got that. And I'm just going to, in red here, I'm just going to write like the thought process behind why I would give someone this, right? And when you're working with someone, there's a medical diagnosis, which a lot of people hunt for and can never find because it's really diagnostically muddy in this area of the body. But then there's a movement-based diagnosis, which is this idea of, hey, there are certain motions that probably reproduce this person's pain. And we're trying to see what motions can we put into the process, or teach them such that, it's like a key that unlocks their ability to do that thing that they couldn't. So you start with basically not being able to do certain things. Then we want to see you do these exercises, or I call these things motions, right? And then through doing that, it unlocks your ability to move better. And if you can move better, an individual kind of components or motions, then generally you're going to move better in life. So, but here's the issue, right? So we've got this idea of, okay, so we think that her sciatic type pain is due to the fact that maybe she's got some weakness in her belly, or maybe she's sensitive to being in this position and we need to get her in this position. Okay, so, we want her to be more rounded. Okay, so that's one thought process. So that's one thing, but then we're also giving her trunk rotation. So core abdominal work kind of works on stability of the spine, right? You're kind of bracing it in this example. But now lower trunk rotations, they're kind of like motion, right? Motion based. So mobility of the low back. All right. So that's a little bit different. And again, you're going right or left. So many people think, hey, Dr. Charlie, like I'm doing, I'm doing all these exercises on the right side. I have to do it on the other side. So a lot of people think that if they do something on one way, they have to do it the other way because, they'll walk around in circles or something like that. But the point is that no, you don't have to. In this case, you might find that, let's say, for example, when she lays down, she twists or drops her legs to the right, and that kind of doesn't feel very good. But when she drops her legs left, that feels fine. Well, maybe dropping her legs into what feels good for her would be something really valuable. But because she's doing it and she's dropping into what feels painful, that could be completely negating the effect of that exercise and making it not work, right? So when all this stuff doesn't work and people come to me and they say, Dr. Charlie, I tried everything. Really what that tells me when I look at something like this is that they tried nothing. They haven't tried anything, because all they know is that this whole thing, again, didn't work. But maybe, again, it was something, there was just one bad ingredient. There was one rotten apple spoils the tree, or whatever that saying is. Okay. So, there's another hypothesis. Now we're saying, okay, hey, I think that you need some core stability work. I think that you're a little sensitive, your back being like this. So we want to teach you to live like that. All right, cool. So we do that. But now the PT is kind of contradicting themselves, because now they're saying now we need more motion and we need it this way. We don't need it this way. Maybe it would have made more sense if they put her into like a cat cow or something like that, because it's kind of reinforcing the same idea. But it's now operating, you're going a different hypothesis. So we've got one bloop, another bloop, right? And now we're on a hip flexor stretch. So now, now we're working the hip backwards, kind of throwing her now into this arch position. And obviously this is to increase motion backwards of hip. So hip flexor mobility. So now are we saying, hey, it's a hip flexor flexibility problem? Well, that's kind of weird, because based off what she was giving up here, you would think maybe it's more of a core abdominal type of, um, hypothesis. And that's the problem. Maybe she needs more core stability. But down here, now we're saying she needs more mobility of her hips. That's kind of weird. Oh, and now we got this piriformis stretch. So now we've got this idea of it's a tight piriformis slash hip joint, maybe something like that. So we're giving her this hip extension. So now we've got hip weakness as a potential hypothesis. So now this is, if you try this, you'll feel it burning in your legs. So this is less of a motion-based exercise, although it's a motion. It's really kind of working like the strength of the hip in this direction. So you're going this direction, and then you're going kind of the opposite, down, away, and back. And then here, so now we're to the third page, right? Maybe a week later or something like that. And we're saying, hopefully these aren't stacked on top of each other, because we're saying, okay, we'll have you stretch. So you need more motion, right? A mobility based exercise, all these different stretches. But now the exact muscles that we were just stretching, we're having them strengthen. So do we need more strength, or do we need more length? Do we need more flexibility, right? So very, contradictory there. I'm not sure what this is supposed to accomplish, but it's in there. Squats, a very generic exercise for overall, again, kind of strength, maybe. I'm not sure. This is weird because we just did clamshell side lying, which, as you can imagine, you're going against gravity. So that's generally, a progression, or is more difficult for them in simple terms than just laying on your back. Now, they do put an elastic band there, but I'm not sure why you would be doing both of them. It's kind of just like repeating the same thing. And here, yeah, you have a band, but gravity helps you fall down. So if anything, this one's easier and this one's harder, but you're doing both of them. I'm not sure what's going on there. Now, again, the forward pull down, the idea is that as you pull down, right, your back probably wants to arch if your belly's not that strong. So you're trying to like kind of keep your belly flat and just work on pulling this band down. So again, this is more of like a core stability type thing. This is more hip strength idea, sort of. Now we've got this, is this core stability? Is it hip flexor tightness? Is it this? Is it that? Now we're saying hamstrings are weak. And that's the problem. I don't know what they're thinking. So I can only make assumptions here. And then standing calf stretch. So again, there's many theories that we could keep talking about, but I'm not sure what's going on with this one or what their thought process is. Now, side step with band. Again, this is kind of like an advanced, it's basically like a standing clamshell. If you think about it, right, when you do clamshell, you kind of do this, but when you're walking side to side, you're kind of doing a similar thing. So it's just an advanced hip strengthening motion, right? So there's some similarities there, okay? Now, remember before we were doing the one where we were standing, kicking our leg back. Picture that lady. In this one, we're just making it more difficult. So hip strength in the backwards direction. And now we're back to stretching. So now if the piriformis stretch didn't work, pulling it, why don't we just push? And it's, again, more mobility of hip. All right. So we've got many different hypotheses at play. It gives me a headache just trying to figure out what the heck is going on here. Again, look, it's not good nor bad. It's just, as you can see, there's so many different thought processes about what could be the cause for pain that it's almost impossible to tell what the heck is going through the PT's mind. So if you ask me, they're confused. And then if the PT or the professional you're going to seek is confused and they don't have a process for solving this, then you are sure as heck going to be confused. So now, again, like I said, though, no motion is neither, it's not necessarily good nor bad. So if you're doing this, it's okay. I would stop doing it all and I would find a more systematic approach to go after finding what the solution is for you. But, let's just start here. So what should you do if this is something that kind of looks like what you're currently doing to solve the problem? If you've got that sheet of exercises and you can tell, wow, this person's really like all over the place. They're trying all kinds of different things. Well, here's what I would do first. So kind of here is the process. All right. So I'll just lay this out way down here. first things first is that you want to test the body. And what do I mean by that? You want to find some motions in your body or things that you do that reproduce your symptoms. You want to find some things that move well, don't move well. You want to find some, for lack of better terms, what one of my mentors calls yucky motions, things that just feel stiff, uncomfortable. You're not sure you want to do them. They, cause maybe pain in your buttock down your leg. All right. So test with caution, but you're just kind of scanning your body to see, hey, what works well, what doesn't work well. So just a simple scan here. I mean, just using a few basic motions, you can walk along with me, is go ahead in your chair and you're just going to twist to the right. I don't care where you put your arms, twist to the left. All right. And then what you're going to do, so we'll say twist is first. What you're going to do is you're going to kind of, as you're doing it, be thinking, what am I feeling? And just rate it, right? So rate it 0 to 100. And what I mean by that is 0 is there's no pain or problem. We'll call it, where 0 equals yummy, good motion. All right. And 100 equals like yucky, the yuckiest possible motion. All right. So ask yourself first, as you twist to the right and as you twist to the left, wow, is it yummy? Is it good? And if not, it's yucky. And is it low, medium, or high? The higher the number, the yuckier it is. So is it low? Is it 10, 20, or 30? So for example, I twist right, it's a little tight. I twist left, it feels better. So now I don't have any pain, but let's just say, ooh, it's a little kind of uncomfortable, my back, my buttock. I would say it's kind of low. There's a little bit of asymmetry there. It's harder to go to the right in this case, a little bit easier to go. So I'm going to call it like a 20. If it's low, 10, 20, 30. If it's medium, 40, 50, 60. If it's high, 70, 80, 90. Now look, this is just kind of the way that I've been sort of trained to do it and think through it, and it works really well. At the end of the day, you're just trying to get an idea of what does it feel like. So you could just say, hey, I feel a little bit of this, or come up with your own scoring system, 0 to 10 if you like that better, but just you're trying to take a snapshot of what that motion does. Okay. So twist. And then the next thing, let's just say that's one motion. Just do something simple. Pull your knees both up. So we'll do knee to chest. Again, you're going to do it right versus left, and you're going to kind of rate and score those. So let's just say pain is on the right side. You pull it up and you're like, ooh, and the left side's perfectly good. Then this one's yummy. And this one's maybe like, I don't know, ooh, it's medium. We'll call it a 50 and then write that down. And then, 2 more motions, just do a figure 4, something like this, right? On the good side and the bad side. And then you're going to rate it again. And then last one, start with your legs just straight. You're going to raise it up and then raise it up. All right. So we'll call it a leg raise. 4 simple motions. And you're just going to rate them all. Doesn't matter what your scores are. It's not good nor bad. You're just going to rate it and you're going to get a baseline or a snapshot. Okay. So you just tested the body. Now what you're going to do, all right, is obviously like the motions that you do, you want them to make you feel better. I think that's the goal for most people watching this. So right away, look, just realize that, for example, if you're doing like a figure 4 and it's yucky on your one side, the painful side, it reproduces some symptoms. And, a knee to chest is also the same and yucky. So let's just do it like this. You've got a few yucky motions, knee to chest, figure 4, and twist right. Let's just say, okay. So, and let's just say this is all on the right. So all the right side, just highlight that. So now what you want to do is go back right away and just cross off any motion that is exactly those yucky motions. So for example, I can't tell you how many people say, Dr. Charlie, like this is so painful. But what do they have you doing? They have you doing the exact thing, which in the, test of the body or in the scan of the body is yucky for you. So right away, I'd say, why would they have you do something like this? Do it. If it's yucky, then do you want to do something that makes you feel yucky in a moment? Because multiply that times, 3 times, 15-second holds, 2 times a day. Do you think that something that makes you yucky right in the moment, the more you do it, it's magically going to make you feel better? I'll tell you, you might believe that right now, but I'll tell you that that rarely ever happens. So, I would say right away, don't do it. If it's a yucky motion, go through each of these one by one and say, is it yucky or is it not yucky? Any ones that are yucky, cross it right off. So we said the figure 4 was yucky, the twist was yucky, and the twist was yucky. So this is pretty close to a figure four, right? Kind of laying on your back and pulling it up like that. So I would say that one's off limits for you. And oh, look at this. This kind of looks like a twist. Lower trunk rotations. It is, if you think about it. So for example, if you twist to the right, and we said that was yucky in this example, then which way are your legs? They're to the left. All right. So if you lay on the ground and you put your body to the right and your legs to the left, right? I can't lay down because I'm tethered, but you can imagine that it is the same thing that they have this woman doing in this example. So if this is you and you just went through that little body scan, you found, wow, this twist is really yucky, then why are you doing the twist? Just a different position. Now, if you do it and it's not in lying down, that's fine, but you just want to start thinking like that. So erase anything that is painful or yucky to you and start there. Okay, and then that might help. It'll cut your exercise program in half. So now you've got, you had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So she had 15 things she had to do, 3 sets, each side, twice a day. Crazy. Anyway, point is that, cross that off. And now instead of 15, maybe you've got, I don't know, 12 or something. So it starts to help to narrow it down. Now what you're going to do, okay, is you're going to start with either a motion you think helps, or just start with the first yummy motion. Meaning if you do the posterior pelvic tilt and you feel like that's something that's helpful or doesn't hurt, let's just start with that. We don't know. It's kind of a mystery motion, we'll call it. Start with that and do it just like they ask. All right, so do it 10 times, 2 sets. Don't do it 2 times a day yet, but I want you to do this. So we're going to go down to the process, okay? You tested the body. You just wrote down some scores. So maybe you wrote down, for example, I'm going to change the font here. Hang with me. You wrote down knee to chest, and that was a 40 on the right, and a figure 4, and that was a 50 on the right, and a twist, right? That was a, I don't know, 60. All right. Now you're going to go ahead and treat using that pelvic tilt, the 2 sets or however you've been doing it from PT. Don't worry about right or wrong. Just do it. All right. So go ahead and do that for a set, right? Just like they recommend. And then you're going to go back and you're going to retest. What are you going to retest? You're going to retest these things, these motions. All right. And you're going to then rescore. Do 1 time. When I say retest 1 time. So for example, it'd be like you tested, ooh, okay, you've got your numbers 40, 50, 60. Go ahead, do that posterior pelvic tilt right now. Do it, lay down, obviously, just like they recommend, and then immediately get on up and test 1 time the right knee and chest. You might say, wow, it's pretty good. Now it's a 20. And then do your figure 4. Ooh, that's even a little bit better too. I think that's a 30. And now go ahead and do your twist to the right. Ooh, that was a 60, but I feel like I can go a little bit further. Cool, it was 50. So now, and then you want to ask yourself, hey, do I think that one exercise they gave me is valuable or not? Should I keep it or should I kick it? Or does it make no change, right? So you want to do that for each of these. So go ahead, stop the video, do that right now, all right? And you're just going to find, based off a simple assessment of testing the body, rating it, getting some objectivity behind it versus like, oh, it just feels good or kind of feels bad. No, give it some numbers. You want to treat using each of those, plug each of those motions in, right? So you're going to go ahead, you're going to do this just like they prescribe. And then you're going to retest those yucky motions, rescore them, and ask yourself, same, better, or worse. Did the scores go less, better? Did they get higher, worse, or did they stay the same, right? And then after that, maybe you draw a smiley face. Maybe you come back to it and you say, okay, what did this do? Oh, we just found that, this thing makes me happy. Cool. It's a good motion. It's a yummy motion. Has the potential to help you, right? We cross that one off because it was yucky. And then go do this one and test, treat, retest. And then maybe you find it, oh man, this actually makes my back worse. Okay, well, do you think that you want to be doing that one? Probably not. You're going to cross that one off. You're not going to do that as part of your program, right? You're going to go ahead and you're going to say, ooh, hip extension, this one where we're straightening back. I wonder if I like that. Well, I know that I didn't like the hip flexor stretch. By the way, look at that hip flexor stretch. It throws your back into this position. kind of this motion or this movement pattern. Look at this standing thing. Same idea, going backwards of the body. So my guess is a professional who does this all the time, is that you're not going to like that. It's pretty much the same thing, but go ahead and just test it out. Remember, if you're not testing, you're guessing. So I'm just making a wild guess based off my experience, but go ahead and test it out. And you might find, hey, wow, that also makes me worse. We're not going to do that. Right. And you get the idea. You're going to go one by one through this. And what you might find at the end of the day is that maybe you have, a couple motions that you like doing. And yes, it is possible stretching your calf can help you. So don't try to make sense of it. Just think of motion. You're trying to find the key, right? You're trying to work through sort of what they've given you and sort of narrow down, at least as a starting point. Again, if you want my help, go ahead, apply to chat me, visit www.calldrc. That's in the description. But again, you're going to have maybe at the end of the day, instead of 15 different things, maybe you find that you just have, a few things. So hopefully that is helpful. That is the exact process that I use with patients, not using these motions. I find a lot of these motions in her case aren't super valuable, but hey, it's a good starting point. At least get you into some framework so you can stop the chaos of doing all kinds of different things. So again, if you're baking a cake and you throw all kinds of ingredients into the pot, just like this, just like the packet of exercises, the chance that you're going to be able to solve it is going to go way down. And if it does work, you're not going to have an idea of what's working. Is that useful? I mean, yeah, it helped, but at the end of the day could we be better than that? Could you have narrowed down maybe one thing instead of 15 things that, were valuable and could help you moving forward? It would save you a heck of a lot of time, and it would teach you a lot about what's going on. All right. So you want to be thinking systematically, whether the motion is right or wrong. Stop thinking of motion as that. Stop thinking as, hey, what is the right exercise or the wrong exercise? Instead, start testing. Because again, if you're not testing, you're guessing. So you want to take everything, all the madness that you've been given to solve this problem, because by the way, there is a lot of madness out there. Okay. And you want to use a framework. All right. Test the body. Immediately get rid of any yucky things that you find, oh, when I do this, it hurts. Well, if you're doing any of these exercises that hurt, I would say to start, cross them off, get rid of them. Maybe just then stick with the rest of them if you want, see what happens. But if you want to get more specific, test the body, give it some score, some sort of objective mark of what it feels like. All right. And then go ahead and treat the body using one exercise at a time. Then you're going to go ahead and retest and say, what happens to the quality of my motion? What happens to things that were yucky? Do they get less yucky? Do they move towards yummy? If so, it's probably something you're going to want to do, right? Keep it up. So after you've tested the body, you've treated, you've retested again, then you're going to have an idea of sort of, where you should be moving, what you should be doing, what you shouldn't be doing, and what things are just a waste of time because they don't change anything, right? So hopefully that is helpful. Again, I get these emails all the time. So if you're interested in helping me sort of, analyze what's going on, take a look at with a new lens, what you've been going through and what you've been told to do, and potentially help you work out a new plan, then go ahead in the description below, visit www.calldrc.com, apply to chat with me. And if you're serious about solving this using motion, by the way, just remember, you're only one motion away. A lot of times we can find one motion or just a small series of motions that can unlock your potential to heal. Again, simple process. It's not always easy, but this is hopefully a good start for you. So thanks so much. Hit the thumbs up button, subscribe for more like videos. And until next time, thanks everyone.